The aim of this video is to give you more information about a specific type of radiotherapy treatment for certain types of gynecological cancer in the Northern Radiotherapy Network. This is called brachytherapy. Brachytherapy is a highly specialised treatment and is not available in all of our centres. If you require this treatment, you will be referred to the Northern Centre for Cancer Care at Newcastle or the James Cook University Hospital in Middlesbrough, and you will be looked after by a team of brachytherapy specialists. The information in the video covers what is involved in brachytherapy, including aims and side effects, as well as the benefits and risks of alternative treatments, including no treatment. It will help you decide whether you wish to go ahead with the treatment, and you will have the opportunity to discuss any questions or concerns with your clinician.
When we're treating you for cervical cancer, you'd have the 5 weeks of radiotherapy. So that's Monday to Friday when you come in for your radiotherapy, and one of those days you'll have a chemotherapy as well. So that's the 5 weeks, and after that there's another form of radiotherapy that we deliver to the remaining tumour after the 5 weeks, which is called brachytherapy. So brachytherapy is internal radiotherapy, which is delivered, through a radioactive source straight to the tumour. So you're given a lot of information during those 5 weeks. We also see you in a review clinic. We'll see how you're doing, address any side effects, support you through that treatment, and then we discuss the brachytherapy side of things in more detail.
What is brachytherapy? Brachytherapy, or internal radiation therapy, puts a source of radiation in or near the cancer, or close to where the tumour has been removed following surgery. It's a local treatment and only treats a very specific part of your body. It will be given to you following your 5-week course of radiotherapy, using an external beam. For patients with cancer of the cervix, brachytherapy is delivered as an inpatient, which means you will be required to come and have a short stay in hospital.
With the external beam radiotherapy, where we're shining the x-rays from the outside, we can deliver a certain maximum dose because the bowel is in the way, and we don't want to cause, damage to the bowels longer term, damage to the bladder longer term. So the advantage of brachytherapy, once the tumour has shrunk after the 5 weeks of the external radiation, then the brachytherapy delivers the radiation to where we need it to be, so straight to the cervix. And because of the way brachytherapy works, we can limit the dose to the surrounding organs, so to your bowels, to your bladder, the rectum. So we can get high dose to the tumour, curative doses to the tumour, whilst limiting the doses to the organs at risk. So that's why it works really, really well.
For patients with cervical cancer who will be treated using brachytherapy, you will have one or more hollow tubes, called applicators, put into your womb or vagina. The radiotherapy is given through these tubes.
The machine really just looks like this rectangular box, and it's got the radioactive source in. The radioactive source will then go straight through to the applicator, the top of the vagina, which is where we're treating, and then back to the machine again. And the whole thing takes about 20 minutes or so. It's actually the preparation for the treatment that takes the longest. So, you'd be here for about an hour, a bit more, but the actual treatment, 20 minutes on the couch. And again, you won't see anything, you don't feel anything at the time of the treatment. And once, the treatment's done, the source is back in the machine, then the applicator is removed.
For patients who have not had a hysterectomy, the applicators are inserted into your vagina and then placed alongside the cervix. For patients who have had a hysterectomy, the applicators will be placed into the vagina. The machine is operated by a therapeutic radiographer or clinical technologist who specialises in brachytherapy.
When you have the procedure, you're either under a general anaesthetic or a spinal anaesthetic with sedation, so you definitely can't feel, the applicator going in. So, and then when you wake up in recovery, you'll have what we call patient-controlled analgesia. So that's a small needle that goes in just, through the skin and delivers pain relief, usually morphine-based, and generally that provides extremely good pain relief after the procedure. Because of the nature of the treatment and having the applicators in, that stays in overnight, so you'll have to lie flat overnight, and then you'll have the second treatment on the following day, and then everything is removed, and we use gas and air for the removal applicators. And we've done a patient survey recently, and we've had very good patient feedback feedback about the procedure, how well they're supported throughout, and the pain relief as well.
Side effects of radiotherapy for gynecological cancer usually build up slowly after you start your treatment. They may continue to get worse after treatment finishes, and then they will gradually improve over the next few weeks. Your radiotherapy team will explain what to expect and how to manage any side effects. Please view our video on side effects for gynecological cancer for more detailed information.
We absolutely understand that it's a very difficult, emotional time for women undergoing treatment for the gynecological cancers. And often what I tend to see is actually when you're having the treatment, you're just focusing on getting through a day at a time, and it can often hit you at the time when you finish the treatment, and suddenly, you know, you have a lot of time on your hands to think about your diagnosis, to think about what's happened. And what we would say is, please pick up the phone, please reach out to us, and we can organise counselling, we can organise clinical psychology support to help you through that.
Following your treatment, your health professional will talk about what happens next. You'll have ongoing follow-up with your healthcare team. We are aware that some patients may require extra support and help whilst visiting the department. If this is the case, please let us know either in advance or on the day of your visit, and we will assist with your needs in any way we can. If you are running late for your appointment, just let the department know and don't worry. We try our best to keep to appointment times, but delays do happen sometimes. If we are running late, we will let you know. Please visit the Northern Radiotherapy Network website if you have any questions or queries.